Welcome back to Drug Talk, everybody. In today's video, we're going to be discussing some medications that are used during end-of-life treatment. Now, before we jump into the content, I just want to quickly let you know or remind you that my new book, The Fifth Episode, is now available for pre-order, so you can get this book by looking at the links in the description of this video. So when a patient is suffering from a chronic illness and they've reached end-of-life care, there are some therapeutic options and different things that can be done to relieve pain and give comfort to the patient. The existence of unrelieved pain is considered a critical factor that can obstruct a patient's dignity during end-of-life care. At times, it can prove to be very difficult for family members to watch their loved ones in pain and not receive appropriate medication. During this end-of-life care, some of the most commonly prescribed medications seem to be acetaminophen, haloperidol, lorazepam, and some patients may receive morphine, prochlorperazine, or atropine. All of these medications would typically be found in an emergency kit that would be used for a patient who's entered a hospice facility. The most commonly recognized pharmacological interventions seem to be analgesics such as narcotics or non-steroidal anti-inflammatory drugs, and some patients may also receive non-pharmacological interventions such as cognitive therapy, biofeedback, or physical therapy. In a 2015 study, they found that the three most commonly prescribed medications during end-of-life care were morphine, midazolam, and haloperidol. These medications were used in 21, 11, and 23% of patients, respectively. At the day of death, these percentages had increased to 87%, 58%, and 50%, respectively. Another common treatment that is required at end-of-life care is to prevent oropharyngeal secretions. One medication for this treatment would be a scopolamine transdermal patch applied once every 72 hours. And some other patients may receive glycopyrrolate given subcutaneously or intravenously every 4 hours. With the use of all of these medications, the main point to drive home here is that these medications are used to provide comfort and maintain the dignity of a patient during end-of-life care. Alright everybody, that's all we're going to talk about today in this short video discussing medications used at end-of-life therapy. Take care.